Good afternoon, everyone. Welcome to our July State Advisory Council meeting for early childhood. I'm Morgan Crossman. I'm the Executive Director of Building Bright Futures, which is Vermont's Early Childhood State Advisory Council. And I'm thrilled to virtually see all of you in this space on a Monday afternoon. Thanks for joining us today. In terms of logistics, I would love to see our State Advisory Council members on camera. And for those who are not part of our State Advisory Council, there will be a section of the meeting where we're inviting you back into the space on camera, but we'd love for you to introduce yourself in the chat bar and want to give you a heads up of what we're going to be tackling during today's meeting. Next slide, please. So we'll have a little bit of SAC business, which will be our roll call and potentially a vote on our June 2026 SAC meeting minutes, again, depending on whether or not we have quorum and today's discussion with our SAC leaders. A lot of folks are on vacation, so we'll be playing that by ear in just a couple of minutes. The purpose of today's meeting is really to have a discussion about the results from our strategic plan summit that was back in May and really talk about where we go from there and how do we move from all of the information that we heard and discussed during that time period as we move towards policy recommendations for the coming year. So that's our summit to action section of the agenda. And then we're holding a lot of space in today's meeting for a public forum. And so for those of you who are new to Building Bright Futures and our network, our public forums are just one example of our monitoring strategy to hear from early childhood partners across the state about the current needs and challenges that are impacting kids and families. And so, quick invitation, and we'll try to do this a couple of times during the meeting today. If you are here to be able to speak for public comment in that 2-minute window, we'd love for you to note that in your chat, in your introduction, even if you've already done that intro. Please let us know if you would like to be in that in the queue for public comment, so we make sure that we're leaving enough time. And we'll try that again a little bit later this afternoon as well. And before we transition into some of our business, I do want to do a quick celebration and welcome. For those of you who have been with the organization for quite some time, we've worked so hard to partner with folks across public and private and community-based sectors to think about our revenue sources and really diversify the way that we are building our budget on an annual basis. And so in this year, we have invested in a full-time senior development manager for the first time as an organization. So wanted to welcome Martha Spear, who joined our organization on June 8th. So she is in our space with us today. So just a quick welcome. Feel free to say hi to her in the chat bar. And if you're interested in partnering with us on development strategies, we're really excited to talk with you about it. All right. I am going to turn our meeting over to Erica McLaughlin, who's going to run council business for us this afternoon. Good to see you all.
Good to see you all. Happy to support this beautiful group. I'm Erica McLaughlin, and I serve as the treasurer and member of the SAC Executive Committee. We're going to start with a roll call for our public partners. All right, Janet McLaughlin, DCF.
She is arriving a little bit late today.
All right, thanks. Laurel Omland, Department of Mental Health.
Hi, Laurel Onlands, Department of Mental Health, Director of the Child Adolescent Family Unit.
Great, welcome. Pat Fitzsimmons, Agency of Ed. Hearing none, I'm going to keep going. Renee Kelly, Head Start State Collaboration Office.
Good afternoon, everyone. Apologies for being off camera, feeling under the weather today. But good to be with you all. Renee Kelly, Vermont Head Start Collaboration Office Director within the Child Development Division at DCF.
Feel better, Renee. Lindsay Barron, Family Services at DCF. Monica Hutt, representing the Governor's Office. All right. Our legislative representatives, Representative Ray Garofano.
Hi, everyone. Ray Garofano, Vice Chair of Human Services, representing Essex and Essex Junction. Nice to see everybody.
Welcome. And Senator Martine LaRocque Gulick.
Hi, everyone. Senator Martine LaRocque, Chittenden Central, S6 Junction, S6 Town, Burlington, Winooski, a little bit of Colchester, Vice Chair of Health and Welfare, and on the Finance Committee. Nice to see you all.
It's a lot to remember. Well done. All right, and now our private at-large members, Becca Webb, Early Ed,
Hi, everybody.
Margaret Walsh, Northeast Counseling and Support Services, practicing my teacher wait time, Amber Houston, Parent Representative.
Hello, everyone. I'm here.
Great. Kiana Heath, Vermont Network Against Domestic and Sexual Violence.
Hi, folks. I'm here too.
Great. Dimitri Gardner, Business Representative.
Yeah. Hi, folks. I'm here. I'm sorry I'm not on camera either.
Eddie Gale, Henderson Foundation.
Yes, and I'm here on camera.
Good to see you. Sharon Harrington, Vermont Association of Education of Young Children.
Hi, everyone. Nice to see you.
And Dr. Deb Hartswick, retired pediatrician.
Hi, here.
Awesome. Nice to see you. Nancy Powers on vacation. Do you want me to read go through those that are not here?
I think it's fine for you just name who's sending their regrets today.
All right. Sending regrets are Nancy Powers, Christy Swenson. No, Christy's here for Nancy Powers. Let's see. We have Lisa Stahlberg, Carol Ann Godden, Susan Coburn, Laura Young, and Debbie Singizer. And then a few transitions. We have Jessica Vintiner has left her position at ACCD and looking for a replacement for Susanna Davis. Perfect. Thank you.
And Pat, we did see that you are here. Thank you. Pat is here from the Agency of Education.
Great. Do we have a quorum to vote?
We do.
All right. Can someone make a motion to accept the June 2026 SAC minutes?
I move to accept the June 2026 minutes.
Thank you, Ray. And a second, please.
Martine LaRocque will second. Thank you.
Thank you. Any discussion? Hearing none. All in favor?
Aye.
Hi.
Aye.
Any opposed? Any abstentions? All right, the minutes have passed.
Thanks, Erica.
My pleasure.
For those just joining, if you are here for public comment, we are doing public comment towards the end. Just definitely indicate in the chat bar as early as you can whether or not you'd like to speak so that we make sure that we're holding enough time for that and we'll adjust accordingly. So really happy to have you all here and great to see a lot of our SAC members. And we can turn it over to Anna to talk about Summit to Action and policy recs.
Thank you, Morgan. It's great to be with you all. Anna Brulette, I'm the Policy and Program Director at Building Bright Futures. And like Morgan introduced for us, I'm going to just kind of set up this next section of our agenda. And we really want to spend some time with you all thinking about what we learned in May at the Strategic Plan Summit. Most of you were at the Strategic Plan Summit, but just to kind of reground us, at the May Summit, we had over 100 folks from our network in attendance in person and had really rich conversations across 9 small groups that focused on different topic areas, with kind of deep dive conversations related to the current needs of children and families and strategies that might fit those needs. So in the chat, I'm going to put a link to a blog where we summarized a bit of what we learned from each of those 9 small groups. What we're doing today is really kind of bringing you all in and along on our process of thinking about what we learned, what gaps might be missing in the data that we collected, and then really thinking how to take that information and insights and turn those into kind of next steps. So we are going to explore 4 topics, 4 of the 9 topics that were explored in May at the in-person summit. And our team is setting up those small groups in the background right now, and you'll eventually get to choose. But those 4 topics we're going to focus on today are navigating isolation and PMADS, recruiting and keeping our health and mental health and specialty workforce, strengthening transportation systems, and improving system navigation for families. We encourage folks to kind of join whatever topic interests them the most. That might be one that you already explored in May, and really want to support us with thinking about how to move towards action on, or it might be something you didn't get to explore or are curious about. Whatever kind of is calling to you today. Like I said, I think part of the reason we're excited to bring this conversation to the SAC and our partners today is to really kind of open up our process a little bit more in terms of how we think about Building Bright Futures roles to advise and monitor on behalf of the early childhood system, to a wider audience. When we advise the state and decide which priorities to elevate, we are always asking not just what the problem is, but what would actually move it. So that's really kind of going to be at the heart of the small group conversations that we have today. Really want to encourage you all to help us think through what the right lever is, and have some prompts that in the small groups we'll have a Building Bright Futures team member be both a facilitator and a note taker. And they'll kind of help you walk through what we're hoping to get to today, but really want to hear from you all whether the topic at hand requires kind of policy change, additional investments, the change to implementation of a given kind of program or rulemaking process, or whether it's an area where we need better data first before kind of thinking towards next steps and other action points or levers. So today we're really kind of asking for you all to help us think through what those next steps are. As Morgan alluded to, this is kind of part of the way in which our team thinks about with partners, identifying areas that are ripe for a potential policy recommendation. So, would be particularly interested, from these small group conversations to hear about any particular policy recommendation or legislative ask that people feel is timely or appropriate based on where these topics are. So with that, we are going to ask folks to choose breakout rooms. You should see 4 of them open up shortly. Again, join whichever is most interesting to you. We're going to take about 20 minutes in the breakout rooms, and then would ask that folks are ready to come back and share. And we would love to hear kind of what next steps or action items your group has talked about. So with that, we'll let folks choose their rooms. Please hang out here if you have any trouble joining them, and someone from our team will help you out.
Thanks, Anna. I'm going to pause the recording and help anyone who needs help getting into.
All right, welcome back. We'll give folks just another minute to come back to the main room. Hopefully that went smoothly for folks and you had enough time to get into some good conversations. I'm excited to take a look at all the learnings. So I would love to just take a bit of time, and we want to save plenty of time for our public forum. And again, as Morgan said at the beginning, if you have comments or a story to share, invite you to put your name in the chat so that we can keep an eye on who is in the queue. But I want to take a bit of time before we transition to that, to kind of share out how the small conversations went and what kind of next steps or action items folks identified. So I'm going to ask for a volunteer or 2 from each group to just kind of briefly share a couple of things, and I'll read these prompts and also put them in the chat for folks to reference. So we would love to hear from groups about one or two next steps you landed on, who should be involved in helping to lead it or who needs to be at the table, and what kind of action or actions you think are appropriate for next steps. So thinking about whether or not we're ready to think about a change in law or funding, or if there's kind of more exploratory steps such as data collection or something else like convening that needs to happen first. So I will put those in the chat, and I would love it if someone from the first group related to navigating isolation and PMADS would be able to share a few things.
I'll start, but then I would like to tag team some other people who are in our group. So we had some great conversations about Dulce and around the closing of birthing centers around the state, particularly with the Brattleboro Hospital Birthing Center being slated to close. And then as far as next steps go, we talked specifically around Dulce losing its funding in the next year. And I would love to tag Sarah forward to share some of the things that she shared around Dulce funding and how to move that forward.
Sure. I think my colleague Brina Holmes is going to join us a little bit later too and talk a little bit more. But basically, the gist is we have a lot of great services that we know work. And then the missing piece is substantial, sustainable funding. So having lots of data around Dulce being a really effective strategy for all these different perinatal care type things isn't enough. We need some conversations with people who are connected to funding, who are making decisions at the legislature and other places so that we can really be thinking about how to create sustainable funding streams for services where we have lots of research that says that they're moving and that we're moving the needle around services and making those available to everyone. And then Sarah Orr was also in my group and just spoke to the universality of Dulce and the ways in which universal design makes this an effective strategy across the gamut. So for people with means and those without, because this is a service that's available to all, and how important that is to have a really effective universal strategy.
Thank you, Michelle and Sarah. That was great.
Actually, can I add one other thing?
Sure.
And then all of this relates to some of the data that's been collected around people missing postpartum appointments because of travel or because of transportation barriers, which I know one of the other groups discussed. And so that intertwining of the issues, how, if we close birthing centers and we're in a very rural state where a lot of people have transportation barriers, and that means a lot of people miss important appointments.
Great. Yes, my group had lots of rich conversation about that interconnection as well. Okay, we're gonna move on to group 2, which I saw was really large, so I have to imagine they have some things to share. So anybody from the mental health specialty workforce group able to share a couple of learnings, couple of takeaways?
Sure, this is Martha Spear. I'll start the conversation off and then pass the baton. There was a repeated theme of churn in the professional workforce, and also those who are being educated in this region moving on to other areas. Some of the reasons that people mentioned were the return on investment for the work. It just doesn't make it worthwhile. There's so much administrivia, there are so many barriers, and people might find it easier to practice and feel fulfillment in other states. Amber made the point that we need to make sure that providers who are actually putting the work in right now, doing the services right now, we need to find ways to get them at the table here in this room and at the legislative table to inform decision making. And someone piggybacked on that and said that finding an incentive to help those folks make that movement might be a good idea. And Amber, if I could surprise you and pass the baton to you to speak on that, that might be useful.
Yeah, I mean, I can just add that I think the question was asked, what's an important first step and who needs to be at the table? And I think it is really getting the right people who are involved in the work there to share what's really happening on the ground, and what would actually be useful rather than decisions being made kind of at a higher level that might not actually trickle down. But the challenge is that when you're already on overcrunched schedules and tough financial pieces, that most people just can't take that time out of their day. So finding a way to do that is really important, to have those people at the table. I think, is that what you were hoping I would be kind?
Yes, thank you so much. Anybody else in group 2 wanted to add something?
Excellent. Thank you, Martha and Amber. Oh, sorry, Deb.
Yeah, and I was just going to add one thing that I didn't get to say in our session, but just I think looking at alternative training models also is something that can be explored. And for example, the American Board of Pediatrics right now is looking at changing how pediatric fellowships work and shortening the length of time that fellows are in their kind of didactic part of their fellowship and getting into more clinical care, and then that dovetailing into being a future attending and providing care. So that can be something I think that could be explored in other, again, disciplines as a way to try to bring people into the workforce sooner. Because when you're tacking on a fellowship or, higher level training to what's already been a fairly extensive, course, I think is something that, again, not only adds to length of time as people are thinking about their own kind of life and moving forward with life, but also delaying sort of their financial, safety net that's going to help them to pay back loans. So if that can speed up, that may also encourage people to be able to move into these disciplines.
Absolutely. Thank you. Okay. I think I'm going to move along to group 3, which was strengthening transportation systems for young children and their families, which was my group. Anybody from my group want to share some of the conversation we had around action steps?
I don't know if I can speak to action steps so much, but we spent a lot of time identifying the problem and coming to terms with the fact that it is a big issue in the state. I would just say that one of the most sort of cogent points was that generally, especially with early childhood, it's not always clear sort of who's in charge, and transportation has that same issue. Like, who is in charge of transportation? Is it the AOE? Is it AOT? Is it a group of community volunteers? And because that system isn't really well defined, it's also hard to get good data. So it seems like one of the first steps would be to try to create a system that is centralized and very clear and transparent, and then gather necessary data, because it's a huge issue in our state. And it came up last summer when I was doing the school redistricting work. It came up a lot. So I hope my group thinks that I explained our work well. If not, I hope someone else can chime in.
I think you did a great job. Anybody else from our group? Okay. And like Michelle, I think, mentioned earlier, lots of interconnections that our group and others likely talked about related to transportation and other services, which was really central to how we were thinking about kind of the importance of centering children and families in this conversation. Okay, our 4th group, service navigation for families. Is there a person or two able to share kind of a couple of takeaways and action items?
I can get it started. The group did talk about, some of the things that some of the models that are working, like the Dulce model, to get to families. the idea of co-locating services and right the access point that can create, but certainly spoke to the needs of service navigation. There need to be some universal models, universal access, and how do we message and spread the word, right, so that there's consistency throughout the state. And we also certainly brought up that there is some current work in progress with a work group that's exploring coordinated intake and referral. I will stop there to leave space for the members of the group. Maybe Ellen or Stephanie. Does anyone have anything to add?
Thought you captured it well. Nothing.
Great. Thank you, Tanya, in group 4. Before we transition to the next section, I would love to just kind of take a moment to, starting with the State Advisory Council, hear if there is anything kind of looking across the 4 groups that we heard from and that you participated in. If there's anything that comes to mind as, the area that you think there's the most energy around or the best opening to make progress, anything that strikes you as something you would want our team to do more digging on with some urgency for the policy recommendations or anything else. So starting with the board members, I would love to hear if anyone has thoughts to that, and then we'll open it up. Okay. People are sleepy. It's Monday afternoon. People need to go get a refill on their coffee or chocolate. Any non-SAC members dying to answer this question for the board? If you were going to tell us as a state advisory council or as an organization what you really want us to prioritize of these 4 or something related to them, what would it be?
I'll hop in here and as a non-board member, not that sleepy. In our work, we like to think beyond what is the traditional systems. What are we not looking at? We talk a lot about who's not at the table, who should be in these discussions. That's awesome. That's excellent. In our work, we work a lot with businesses. So we work with the employer to support their workforce under Working Bridges. It's very much a return on investment for the employer to see if you support your employees, you're going to have greater retention, all of that. What I've learned in the many years of doing this work now is understanding what the benefit might be outside of your normal consortium of people that are focused on one primary goal. Is there an opportunity to bring in a for-profit business, a private business entity that could benefit in some way? Let's just take transportation as one example. We're looking at a model right now of working with private car dealers to see if there's a lease model, a short-term lease model that we can get for employees that are either coming here or challenged with transportation options. And then getting the financial institution, which we have great relationships with many of them in our community, to offer them additional financial assistance regardless of their credit at low barrier loans. So obviously that's a big thing to kind of wrap your head around in 2 minutes. But my point is, who are the additional people in our community that you can look at as opportunities of maybe hub spaces or places that create opportunity for a greater return on investment, that really looks at workforce through a different lens, who looks at transportation through a different lens, and start really developing a model that is complementary to what you're currently struggling with, but really recognizing that there are many more partners in our community that don't necessarily feel like they fit in this conversation, but they do. And it's understanding their language and what we could do to really benefit them and reach the goals that we're seeking ourselves. That was a lot. Wake up, everyone. Here I am.
No, that was great. Thank you so much, Tanya. Yeah, great example. Anybody else? have a thought on what you want to see us prioritize or chase after following kind of this conversation of what we learned from the summit and what's next. Okay. Well, if folks have thoughts that come to them after the meeting, after you've had your coffee or chocolate, please don't be afraid to reach out. We would love to talk to you all more about all of these topics and how we might move them forward together. So with that, I'm going to turn it over to Beth, who's going to kind of kick us off for the public forum segment of the meeting.
Thanks, Anna. Hey, all. It's great to see you. Happy Monday, this July day. So we have some time set aside to be able to hear from whoever wants to. Again, Building Bright Futures' charge is to advise the governor and the legislature on the well-being of children and families from the prenatal period through age 8. And the way that we know how to advise is by listening very closely to what families' experiences are with the system, and what providers' experiences are, what leaders' experiences are, and then to be able to move that information ideally to whomever can make some change. So we have made it the practice to set aside some time and at least 2 State Advisory Council meetings for public forum. I just put in the chat a few ideas. So we have a few people queued up to be able to share. Always open to others. It does not need to be prepared comments at all. We are looking to hear what your experience is, or to be able to share an experience of someone perhaps that you've worked with, so that we can really identify where are the gaps in our system, what's not working well, what policies might need to change, or things that are working well that we really want to continue to invest in. So we're going to give folks 2 minutes. I'll track time, and we'll just, if you feel moved and you want to share and haven't put your name in the chat, feel free to do that as we move along. So I will, why don't we just start? Gabrielle Hall. Gabrielle, you put your name in the chat if you want to get us started, and then Olivia Hardwick, you're on deck.
Yeah, thank you. I'm Gabrielle. I'm a public health nurse in Brattleboro, where our birthing center recently, they announced that they were going to be closing. And I just wanted to highlight for some other regions kind of to start thinking about what this would mean for young families and pregnant people in your area. Just start to imagine kind of what that might happen in your region. I also want to add, this isn't like the official state, what the state wants to say. This is information that I researched because I found this interesting. So in the last 2 decades, there's been hundreds of birthing centers that have closed nationwide. There's been 12 in Maine, 11 in New Hampshire, and 2 in Vermont, in Morrisville and Springfield. And it's just time for us to think ahead and be more proactive rather than reactive if we can, especially given that Vermont has the lowest fertility rate out of all 50 states. So some of the things people could be aware of in terms of birthing centers, the risk of closing. There's been some data out of the University of Minnesota Center for Rural Maternal Health, and they cited a number of 200 births per year are needed to sustain a birthing center. And that's not always true. And it's a little bit controversial, but just to have that in your mind that there is this 200 births a year figure floating out there. And in 2024, Brattleboro had 230 births. And then part of the problem of this is, of course, the continued national underfunding of maternal health, leading to this loss of access to care. Medicaid has not fully reimbursed the delivery of a baby since the 1980s. So it's always kind of been a loss leader for hospitals. The hospitals that have been able to sustain low volume births are on solid financial footing to begin with and can absorb some of those losses that come from operating a operating a birthing center, which is expensive. And then I just want to say there's been the community has been really gotten together and organized and vocal about wanting to preserve safe births in the area. But in just my research that I could find, there are very few examples of where community outpouring has been able to reverse a situation like this, and they've been really unusual circumstances. So I just wanted to highlight that we need more than just that, and that the closure of a birthing center kind of has waves of impact across the community in terms of loss of postpartum services, mental health care, lactation. And we're already seeing in southeastern Vermont a decrease in prenatal care, more births in the ER, and more emergency transfers. So just wanted people to be thinking about that.
Thank you, Gabrielle. Interesting. Appreciate your sharing. Okay. Olivia, you're up next, and then we have Christy on deck.
Wonderful. Hi, everyone. My name is Olivia Hartwig. I'm the Data and Impact Analyst at Vermont After School. I first wanted to share what a wonderful time I personally had at the Early Childhood Strategic Plan Summit at Zen Bar, and thank you all at Building Bright Futures for putting that together. It was really inspiring. So my team over at Vermont After School, we took a look at the Prompts for Public Forum, and we really wanted to share what is right now informing our ongoing work to support families and youth in the after school and summer space. So firstly, as Vermont After School, it says in the name, we continue to support after school and summer programs. We continue to work with partners and funders to make sure that after school professionals have access to the supports that they need. And we also want to emphasize the importance of ensuring that anyone who works with children and youth, even if they're not a school employee, has access to appropriate training and support to mental health and well-being. We do this in our own ways. We offer after-school professionals a robust and varied selection of professional development offerings, group trainings, assessments, and certifications. And we're always open to collaboration with our partners in the early childhood field to expand our support. So please, if there's anything that you are interested in learning more about, get in touch with me. Or if you'd like to work together with Vermont After School, we're always looking for more robust ways to support our professionals. Because really that supports families and youth, and that's what we come together to do that work. We also, and this is sort of a personal thing for me, we'd also like to share that we're working on a supply and demand report for the preschool development grant. The chief part of that is to map the facets of wraparound care for 3 to 5-year-olds. So that includes gathering data on public and private UPK providers, preschool childcare programs, after school and summer providers. I know we're getting quite a lot of data from it. So you can imagine, as the data analyst over at Vermont After School, this is my bread and butter. When that project is complete, which we're looking out into the horizon, but when that's complete, we're going to be moving this same data collection on a variety of providers, as I sort of described the landscape there. We're going to be moving our data collection into the K-12 space to ensure that Vermont has robust data about all after-school and summer programs, regardless of their funding or program type, to really support the needs of families and identify gaps in the challenges that families in Vermont face when trying to, get their child the support they need across education, after school, summer and vacation programming, the whole thing. So yeah, thank you so much for the space, and thank you all for this meeting today as well. The breakout rooms really got my gears turning. So thank you again.
Awesome, Olivia. Glad that you could be here. All right. It's so great to hear from so many different people. So we have Christy Swenson next, and plenty of time. So would love to hear from others if you want to share. All right, Christy, would love to hear what's hot in Head Start world.
So I thought I would share an update in Head Start. Just, I guess, to give a little context, Head Start is a program that provides not just high quality early childhood ed, but we also provide wraparound services for the child, and in fact, wraparound services for the whole family. So it's a very in-depth program, and we are partially federally funded. So coming up, I'll back up a second and say that we operate using what's called the Head Start Performance Standards. And so those are basically the rules that we are required to follow in implementing our programs. It's really sets the level of quality is mostly what it does. You must, and that is across all of our different service delivery. In early August, we are expecting a proposal to change what those performance standards would look like. So the rules that we would need to operate under. What we're hearing through leaks is that it is likely to reduce the rules by 90%. It will likely reduce all rules related to serving children who speak English as a second language. It will likely reduce all rules around services to children with disabilities. It will likely have very deep cuts to comprehensive services. So think social work for the families, nursing, dental, mental health, nutrition, all of those wraparounds that we supply. It would also likely reduce teacher qualifications. It would increase class sizes, and it would increase ratios. So that's what we're anticipating will come out as a proposal in early August. Likely then the public will have 30 days to comment on it, which hopefully would result in some changes, because I don't know that I'm excited about having reduced quality standards. To speak a little bit about what I anticipate as impacts if this moves forward, is that it would really impact especially, the quality of the early childhood ed for sure, but even more so all those comprehensive services, which are what really lead our long-term impacts, in my opinion. Know also that we serve, we are federally mandated to serve those most at risk of being behind when they start kindergarten. And so kids who have greater need go to the front of the waiting list. And so we often are serving not a typical population. Some of the things we're currently able to do within the state of Vermont for the kids that are birth to 3, we get 38% of them housed by the end of the year. For those that are 3 to 5, we get 46% of those children that are homeless housed, those families housed by the end of the year. I don't have statewide data, but nationwide data, children enrolled in Head Start are 93% less likely to go into DCF custody. And that doesn't speak to all of the educational impacts or the impacts on likelihood of going to college, completing college, less likely to be incarcerated. But in the short term, I'm really worried about if this comes to pass, how are we as a state going to meet all those comprehensive services that are currently being served through Head Start? I guess that's all I wanted to say. I would love anybody who wants to comment on those proposed changes when they come out to make a comment to the federal government. But other than that, I just wanted to give everybody a heads up.
Thanks, Christy. Those are pretty significant rule changes, and appreciate the heads up. BBF has been issuing comments on some of these rule changes, and certainly will track it. Whew. All right, that was a big one. We are going to move on. Kiona is up, and then Brina, you're on deck, and we have space for others if you feel inspired to share.
Great, thank you. Just briefly wanted to respond to the prompt around the last legislative session and note 3 policy initiatives affecting Vermont's children and their families. that became law in 2026. These are all largely things that lay the groundwork for thoughtful, hopefully comprehensive efforts to improve safety and support for young people and children in the future, and also a lot of work to be done. So some of you have heard me talk about supervised visitation on the State Advisory Council. There was a $130,000 one-time fund created to bolster supervised visitation services this year. Supervised visitation, for folks who don't know, it offers a safe setting for parent-child visits, including in many cases of domestic violence or child maltreatment or child abuse. These programs are essential. They're typically court-ordered, but they have faced recent funding cuts and are not available in several Vermont counties. This one-time investment might help prevent closures, but it's certainly not enough to sustain the existing programs. And we're hoping that it provides a solid foundation for expanding sort of statewide access to care through additional coordination, training, and capacity building for the existing supervised visitation providers, as well as some coordination at the statewide level through the Vermont Network and through DCF, but much more to happen there. There was also S239, which created a new task force to recommend reforms to the mandated reporting laws by October 2027. For folks just to keep that on their radar, mandated reporting can certainly protect children and alert systems to potential abuse. And it's an essential safety measure, and it's not the only way to support children and their families. And so we're thinking a lot about interventions that balance, just meeting the needs of the unique needs of, children and individuals and their families, while also being able to create really sustainable trauma-informed systems around mandated reporting. So the task force that was created provides an opportunity to reflect on Vermont's approach to mandated reporting quite broadly, which is exciting and includes youth needs to access confidential supports and responses to peer-to-peer harm and other areas of mandated reporting that have been sort of less attended to over the years. So we're looking forward to that. And then finally, there's the Hazing, Harassment, and Bullying Prevention Council. It advises the Agency of Education on how to help K through 12 schools prevent and respond to harm so students are safe and able to learn. And H931 updated the council's membership in some really significant and important ways, amplifying the voices of students, people with lived experience, folks who have experienced hazing, harassment, and bullying, also updating its responsibilities to provide a strong foundation for this work and support AOE in some more comprehensive ways. So we're looking forward to supporting that renewed effort. And there will probably be opportunities for a number of folks in this network to support conversations around that as well in the future. Thanks.
Thank you, Kiana.
Yeah.
All right. Brina, you joined just recently. We're giving folks 2 minutes to share.
Hi, everyone. I'm Brina Holmes. I'm a pediatrician. I work at the Vermont Child Health Improvement Program. So I just wanted to talk to you today a little bit about Dulce, which after 10 years is really, we're down to our final straw. We have found every hook and crook funding mechanism we could, and we're now in the last year of the last of the many grants. So we don't really have to stay calling it Dulce. I want to be clear about that. It is an approach called developmental understanding, legal collaboration for everyone. There's been some public policy feedback that people don't love that term, nor do they really want to talk about it. So I'm calling it family support in primary care in an effort to keep it alive. 10 years ago, really, really innovative leaders in the early childhood space in the parent-child center world noticed a few things. One, we have very high rates of well childcare in Vermont and excellent pediatric health care, including access because of our Medicaid policies. So the parent-child center leadership said, why aren't we using that space where all the new babies are streaming in to bring early childhood expertise from the parent-child center over across the street? And they went in search of this approach, and they call it Dulce. And it started in the Lamoille Valley, where the recognition was that if we met every new family, we would have much earlier detection of the circumstances surrounding families' lives for the whole family that would impact a child's development. And the research around the country now has shown that when you do it this way, you pick up 75% more of the challenges that families experience than you would if you waited until something was going on with the child. So whole family early detection, and then we've done great qualitative research with the families that experience this model, that they felt it mitigated the power differential in a healthcare setting, that they actually didn't feel that they were going to be able to tell their pediatrician all the stuff, but they felt very comfortable with the trust and the relationship building that the parent-child center family specialist provided to them in the healthcare setting. So it's essentially a program of asking with trust what parents are experiencing with food, housing, violence, substance use, and their general concerns and questions about bringing a new baby onto this earth. And it's a very inexpensive early upstream approach. And we're going to give it one more try in the legislative session in January with the AAP, American Academy of Pediatrics advocacy. The state has determined it's not on their list of priorities for investment. So we stand with our parent-child center leaders that it needs to be a parent-child center family specialist in the health setting. Others are trying to shift the model that it would be someone you'd hire in the health system. That is not the model. So I'll stop there. I feel I have a lot of more that I could say, and I think a lot of you are great advocates for it as well, but I think we got to all band together one last time to preserve this, because it's also, the last thing I'll say is our pediatric healthcare field is not doing very well. There's a lot of despair. It's very hard to take care of people with all that Vermonters are experiencing. And this approach has been shown to preserve the workforce. That when pediatricians have this level of support from parent-child centers for new babies, they feel better. And they go home at night thinking they've had impact, and they're back to why they picked the field of pediatrics, which I think matters to all of us as well. Thank you for the time.
Thanks, Brina. Appreciate the message to leave on. All right, we have some legislators here to share. Martine, if you want to go next.
Thank you so much. Yeah, and Brina, thank you for bringing that up. I really appreciate that. And I would just say, even if I'm not a sponsor on a bill, it would be great to sort of activate legislators like me so that we can be doing as much work behind the scenes to get stuff over the finish line. So happy to help in any way and collaborate on that. Yeah, please let me know. Also, Kiana, thank you so much. I was going to bring up S239 as an update, but you did a fantastic job. That was a bill that Senator Vyhovsky and I brought forward, and we worked on it in the Health and Welfare Committee, and I think it's really important. So thank you for going over that. I briefly just will mention a few bills. H536, which was a bill to require testing of baby foods for heavy metals. And ultimately also formula. So we're trying to take the toxins out of food consumed by our babies and our young children. So hopefully that will do what it is setting out to do. But that felt like a great small step forward. I wanted to bring up S227, which was another bill that Senator Vyhovsky and I worked with, which is basically a sanctuary schools bill. I think some of you may have already heard about that, but it's really modeled after the work that Winooski did, which is making sure that ICE agents can't just barge into a school and take kids away from their school. Also, it protects student data, and it creates some mandatory policies and procedures that will be facilitated by the AOE so that schools know what to do in the event of an illegal ICE raid. So that one, it was an important first step again. And then there's also the child welfare bill, which was H657. I won't go through all of the pieces. That was a pretty large bill, but I would recommend that you take a look at it. H657. There were many different provisions in that bill, one around restraints and seclusion in when a youth offender is picked up, but also around Social Security benefits and reach up and making sure that kids who need to get a driver's license or a permit don't have to pay fees. So those were all good, really great provisions in that bill. And then just lastly, this was another huge bill, but I think a lot of you know that we currently have around 4,000 homeless folks in the state of Vermont. 600 to 1,000 are children. So this is a crisis that needs to be addressed. And we did pass a bill, H 938, which is trying to put into place a new homelessness continuum, a system in place to really help folks. I think in the short term, it feels very aspirational because frankly, we don't have the infrastructure and the buildings necessary to do everything that we're setting out to do in that bill. But it's trying to move folks out of the motel program into a continuum that will be more supportive. So thanks. Feel free to reach out if you have any questions. Thanks.
Thank you, Martine. And Ray, yeah.
Martine gave my
Updates from
updates.
you.
I was going to cover H 657, which is Act 136, and the homelessness bill. But just to give a little bit more detail on the DCF omnibus bill. So the provisions in that bill, what we did, we started that bill in the House, and we literally looked at our wall and kind of thought, where are all the bills that have to do with DCF and child welfare? And then we put them all in one bill, which made it more efficient and a lot more effective and saved a lot of time. The provisions in that bill prohibit Vermont from using a child's Social Security benefits to reimburse the state for the services that they provide, which many states have already done this and have been doing it for years, prohibiting it. So we were definitely an outlier. So the money then stays with the child. It also, Martine talked about the identification documents allowing 16 and 17-year-olds to be able to get IDs without parental signatures and authorization, and then the secure transportation of kids in custody. That was really big, and Representative Donahue had been working on that, her and Representative McGill for many years. So we're really excited to work with all the stakeholders, and a lot of the provisions in this bill, I want to say, like, there was all the stakeholders came together and worked, the administration, the Office of Child, Youth and Family Advocate, and legislators. So it was really a nice exercise of bringing everybody together and everybody agreeing on the provisions. And that bill also removed the Reach Up asset benefits, which is also really important for families who are trying to save for like security deposit or just saving a little bit of money. It does not penalize them. And then, of course, Martine talked more in depth about the homelessness bill, which we've been working at for many years. So we're really excited that kind of went through across the finish line, but acknowledging that there's more investments obviously needed because the system now will serve fewer people because the supportive services are a lot more robust than they had been. So it was a bit of a tough decision to keep the budget number at what the governor recommended, but also create this new continuum of care, which is a lot more robust to help support families and individuals who are experiencing homelessness. But that just means that we will be able to serve fewer people, which is unfortunate.
Thanks, Ray. Well, thank you for those who shared, and an open invitation. I see a lot of our regional partners on the call and state partners that this is BBF's job, is to listen and then be able to communicate what needs to change to decision makers. Sometimes that we do it formally by building policy recommendations. and testifying in the legislature, sometimes it's very informal in terms of like phone calls or one-on-one meetings with agency leaders or legislators or the governor's office. So as you go about your world, please know that you can always give us a call, whether it's directly to your regional manager, bringing it to a regional council meeting, or just giving us a call, because we're always in this place of gathering information and being able to figure out who needs to know. So with that, we're going to close our public forum. Thanks all for joining. The State Advisory Council does not meet in August, so our next meeting is September 28th. That's a 90-minute virtual meeting. And then very much looking forward to, we have an in-person meeting on October 26th. We'll be in Stowe. The regular SAC meeting, which is the time that we're typically like doing a first presentation of our policy recs and then doing some work sessioning on them. So that'll happen in the morning of the 26th. And then the State Advisory Council will continue on and is actually having a 2-day retreat following that. So for those of you who are community partners that typically join SAC members, just note in your calendar that we'll be in person. And we hope that you'll join us that morning of the 26th. So that is all. Thanks all for joining us, and hope you have a great summer afternoon.
Great to see you all.